So if we've slept funny, or when we first wake up, sometimes we can feel a little bit stiff, or if we just don't have a lot of good movement in the thoracic spine, this is something you can do every morning when you wake up, but you can also do it throughout the day as many times as you like. You don't have to have your fingertips on your shoulders. I like to do it just to bring my focus to the bit that I want to move. We want to have a nice strong core. You can do this seated, standing, however you like. The focus is on your thorax, your thoracic spine, and getting rotation there, which is where we're designed to rotate. So if this is uncomfortable, you can cross your hands across your body. You can bring your hands out in front. You could link the hands. So whatever feels good for you. And we're going to keep the core strong and just focus on rotating. It doesn't look like a lot is happening right now. It's up to you whether you want to bring your head into the movement, or you can keep your head looking forward so your cervical spine is out of the movement. So now we're just rotating from the thoracic spine. You might notice some clicks, some clacks, some sensations of tightness or release. And you also might notice that your breathing goes a little bit funny, as you can probably hear from my voice. There are muscles that are attached to our thorax, to our ribs, that are accessory muscles for breathing. And we are rotating side to side, so we are having an effect on those muscles, especially scalenes posterior, which attaches to your second rib. So if you notice that your breathing goes a little bit funny, don't be alarmed, that's kind of normal. And then after a couple of those rotations, we're just going to relax and come back to the center. Again, it might not feel like you've done a lot, but it does really help to release tension, especially if you can go quickly. We're sort of releasing different fibers in the body. You can do this slowly as well. So you may have been given some needle thread or thoracic rotation type exercises. If you do these slowly, these are also great to get more movement in the thorax, which will help with shoulder pain, help with neck pain. But the slower movements are more controlled and more focused, whereas this quick movement is designed really just for releasing tension, and it's sort of it's almost like it tricks your nerves into thinking that they have a lot more movement than they thought that they had. So similar to the neural glides that you may have had from me, this movement is just a really nice way to release tension, even if it feels a little bit silly.